Hi, welcome. This is Health Matters with me, Dishen Kumar. We are back for season 2, and today we have an interesting topic. We'll be talking about influenza, and joining me today is Professor Tan Maw Pin, the Professor in Geriatric Medicine at University Malaya. Prof, thank you so much for joining me today.
Thank you for inviting me.
Okay, let's start off with the topic influenza. So, what is influenza basically?
So influenza is a viral illness, and it's a fairly contagious virus. So the way we pass virus around is if you sneeze and then the viral droplets drop onto a surface, and then you touch that surface, and then that somebody else who's touched the surface touches their face, then they would actually inhale the virus into their lungs, and it will cause them to then have influenza. So could you imagine in a school where, you know, they're all packed together in the classroom, one child sneezes, and then before you know it, most of the class are off sick. And we all know about this kind of phenomena, and so and flu has been circulating in our community like this for many years.
There are a few types of influenza, right?
Yes.
Maybe explain about that.
Well, there's mainly two types, type A and type B. So those are the main types of influenza. But within each type of influenza, there are these things called serotypes. So because flu is, the virus is not a very high level of life form, so each time it replicates, it makes mistakes. You know? Yeah. So then when the mistake sticks, then it becomes a mutation. So we have a lot of viral serotypes as a result. So so new serotypes emerge over time as the mutations still occur.
Okay. Now, we are doing research about this topic. Before I do any interview, I do some research and on the topic, and realize that the influenza virus can actually change.
Yes.
There is a mutation possibility.
Yes.
You can explain a bit more about that.
Okay, well, I mentioned it's a low form of life form. So every time it replicates, so you know a cell when it replicates, it reads a DNA code, and then the DNA code will then and then they will reproduce the same cell, right? So when it reads it, it makes mistakes. It's not very good at reading. So it'll actually and then this it will become potentially a mutation if that mistake then repeats itself and becomes propagated.
Okay, so we could say that a lot of people, like when you get an influenza virus, it could be a very different strain from anybody else, or does it depend on person to person, the changes in mutation?
We don't know how, we don't know, it's unpredictable. Okay. So it doesn't tell you, and it's very disorganized, and it does things that the women are fancy. Yeah, so I mean, that's why we can have these things called flu pandemics, because suddenly there's a major mutation, and then the vaccine that we usually give out for flu doesn't work, and then it becomes a pandemic.
Okay, all right. Let's talk about common cold versus influenza versus COVID-19. Now, COVID-19 has changed all our lives.
Oh, I know.
And let's talk about maybe the differences between these three, or maybe there's a lot of similarities actually, right?
Yes, I mean one thing COVID-19 has done to us is actually increased our attention on viral illnesses. And you know, we keep talking about the environmental issues, we keep talking about wars, but you know, the thing that can really throw the spanner in the works when it comes to economic progress, as we know, is this virus thing. You know, it's indiscriminate. Yeah, nobody can control it. Just what it wants. So but with the influenza virus, traditionally we've always said that influenza virus is like the common cold, except you get a more severe disease. And therefore, while a lot of people get the common cold, coughs and sneezes, they're probably sick for 1 or 2 days and they're back at work. Whereas for influenza, it's a virus like the common cold, except this virus is more severe, and you can have complications from it. So we particularly always tell babies, young children below the age of 5, and older people over the age of 65, as well as people we call vulnerable groups, people with asthma, diabetes, heart disease, to actually make sure they actually vaccinate against this influenza, because if they catch flu, so for someone with heart disease, for instance, if they catch flu, it could actually aggravate the heart disease. Same with asthma. And the group of people I deal with are older people. So it's even more difficult with older people. When they catch flu, we've always known that when older persons fall sick, they might not have any particular symptoms. They might just be more lethargic. They become more wobbly on their feet and they fall over. And with the flu, sometimes they present just with a heart attack because the virus has put a strain on their heart and you can't cope, so they present with a heart attack. Or it makes the blood more sticky and then they actually get a stroke. So, we've known for a long time that older people present with non-specific symptoms, and by catching flu, some of them will have the flu symptoms, some of them won't. It actually increases the risk of them going to hospital, and of course increases the risk of them actually succumbing. So we might lose them earlier than we would like to because of the flu.
Okay. Let's talk about the flu in Malaysia.
Yes.
The occurrence, the statistics, is actually very difficult. It used to be difficult to get statistics on influenza.
It still is, yeah. Because we've kind of missed the boat, if you like. So we've always thought flu is a winter disease, you know. So the North Hemisphere, winter, you have November, December, the hospitals fill up because, every year you have a increase in flu cases.
Season, right?
Yeah, flu season. And we thought that Malaysia was a tropics, so flu wasn't something that really drew attention because we had other things to worry about like dengue, you know, and we never quite finished with the TB story, and we've just sorted out malaria. So, and then, but as we become, I suppose as our population grows older and these vulnerable groups are getting treatment and so they are actually surviving, those sort of things, we are seeing more and more of influenza causing problem in our community. But traditionally, when someone comes into hospital with a pneumonia, for instance, with shortness of breath, they would just be treated with a antibiotic for a bacterial pneumonia. We don't really screen for flu because we've not known about flu epidemics and things like that. But over the last few years, what we have are private hospitals now being able to access these tests because it's so easy now. You can just buy a kit and then you put a drop of blood and you put it in the machine and it tells you whether someone's got flu or not. Yeah. And last year in particular, there was a lot of attention on the flu epidemic that happened last year, and that was actually being detected primarily by these private hospitals. So as we become more affluent and healthcare becomes more accessible, we are actually discovering that flu is also actually causing quite a bit of trouble when it comes to our healthcare burden. Okay.
Right, Prof, we'll talk a bit more about some common misconceptions about the flu and COVID-19, the common cold, and then we'll move on into high-risk groups for the flu. Yes. Right after this. Join us back right after this. This is Health Matters with me, Dishen Kumar. All right, welcome back. This is Health Matters with me, Dishen Kumar. And today we are with Professor Tan Maw Pin, Professor in Geriatric Medicine at University of Malaya. We're talking about influenza. And let's move on into the common misconceptions people have about influenza.
Okay, so influenza, people tend to think, oh, it's just the flu. So even my own colleagues, oh, it's just the flu. And they call it self-limiting because viral illnesses traditionally we have no treatment, but you don't need a treatment because it gets better itself. Your body deals with it.
You just need some rest and you take time off work and things like that.
Yes, but but we've known that every time the Western countries, the Northern Hemisphere, the Southern Hemisphere, they have the flu season, we're actually talking about millions dying on annually because of the influenza, and that's not really received much of a press. And for Malaysia, because we don't routinely test for flu, there's no flu vaccination as such, then we don't really know what kind of burden the flu causes. Apart from last year when we knew about the influenza epidemic, we also knew that our hospitals were rather busy over that period. So we really need more data. And the first thing we need to do is to increase the amount of testing that we do so that we can actually accurately find out what kind of burden it's causing nationwide. We do know that influenza exists in Malaysia at least, and we do work with WHO. We regularly send them data into for the type of flu bugs that we get here. Okay. So the other misconception people tend to have is that you can't prevent flu. Yeah. So and you know that the vaccinations are only for children, but actually the flu vaccine has been around for decades and it's effective.
Yeah.
You know. And it really reduces the risk of someone having to go to hospital. The other thing that people tend to say, flu vaccine gives me flu. Well, it doesn't give you flu, but when you have that flu vaccine, you might be, for 1 or 2 days, you might feel a little bit achy and a bit tired. Why? Because your body is generating that antibody against flu. That's good news. That means the flu vaccine is working, and that could potentially save your life this year.
But that's practically how vaccines work.
Yes,
right?
that's right. That's right. Yeah.
So let's move on into those high-risk groups that you were talking about earlier for the flu. Like Malaysia is an aging population.
Yes.
So more than 7.5% of the population is age 65 and above.
Yes.
So how do we handle those high-risk groups, and how high of a risk is it for them?
Right. The risk itself is not easy to quantify. But internationally, it's well accepted that all older people should vaccinate annually against influenza, and health systems pay for it, whether it's a national health system in the UK or in America, the insurance will pay for it because they recognize this as cost effective. So we've done a little study at the University of Malaya where we actually managed to swab 4,000 people who turn up to our Rawatan Utama, that's our primary care department, with kind of coughs and colds. And what we found was that around about 15% of them actually had flu. And out of those 15%, we actually had about 50 people over the age of 60. And from those, what we found was that there's a 50% chance of them actually ending up in ICU or ending up in ending up in hospital. And then the mortality rate was astounding. It was at least 10% after 1 year. So we didn't quite expect this kind of amazing statistics, but flu is deadly. Yeah, and we've for the longest time underestimated how bad the flu can be.
Okay.
Yes.
Let's move on into prevention methods. What are some of the things that we can actually do?
Okay, some of the things we've been talking about at the moment with the COVID-19 pandemic is wash your hands often. Yeah, and don't simply just touch your face.
Everybody washes their hands. They take their washing their hands very seriously now. Right?
Yes, I know. And then if you're sick, please wear a mask. Don't go out and cough all over. Yeah. Those are we call contact precautions. And but what is we actually have very effective vaccines against flu, and the world healthcare community take this very seriously. They meet every year and they decide which vaccine against which types of flu they should put in every year, and every year it changes. So that's why you have to have an annual flu vaccine, and people in developing countries actually expect to go into the flu vaccine regularly at some point in time. Okay. So what our problem is that in Malaysia, few people understand that adults also need vaccination. So especially for my older clientele, it's not in the radar at all. And then we don't actually have easily accessible centers that we can go to have a flu vaccine. So I'm a healthcare worker. So I will regularly have contact with older people. So it's a good idea for me to have a vaccine as well, so I don't catch flu and pass it on to them. But it's not easy for me to get a flu vaccine. I literally have to take a day off in my annual leave to go and sit in health clinics to actually get myself a vaccine. So it's not something you would do because you're not sick. Who's going to give you an MC for getting a flu vaccine, and it's not very good for productivity. So we really need to look at occupational health side of things, where they could actually give flu vaccines to healthcare workers, and then we should also actually advise all older people to actually get an annual flu vaccine.
Okay, right. Let's talk about, there is a campaign, Making
Yes.
Flu Prevention My New Normal. But
Yes.
before we talk about that, let's talk about the community that you're in,
Yes.
the Malaysian Influenza Working Group.
Yes.
What is that group?
Okay, this is a very interesting group because it is, we call it multidisciplinary. So we've got experts from the field of infectious diseases, so those are the people who deal with the virus, respiratory specialists, public health, primary care, and of course geriatricians and microbiologists. So we sit together and we kind of plan on how to actually lobby for resources to actually increase the uptake of influenza vaccine. And we've been together now for a good 2 years, so we've met a few times, and we've actually been able to drive the starting of a few research studies to actually look at flu burden in our country in vulnerable groups as well as in older people. So those studies are now ongoing. But with the COVID-19 pandemic, however, we have been far more active than normal. Well, initially it was to help promote some of the messaging that was, because it was the same group of people who would be able to provide the messages.
Exactly.
But now we've actually turned our attention to flu. Yeah, because we know that there is likely to be an upsurge of flu cases as we reach the end of the year, the North Hemisphere winter, and we can ill afford for that to happen. Why? Because if someone turns up to hospital with flu-like symptoms, you can't tell that apart from COVID-19. So we have to treat each and everyone like they've got COVID-19 until proven otherwise. So we've got to isolate them, do all the tests, and that will really drain the resources of our healthcare system. And if you were actually going towards private practice, you would actually drain your own resources as well. So we can't, it will really overburden our healthcare system. So internationally, all the other governments are actually telling the people, you must make sure you have the flu vaccine this year. The Malaysia, for a lot of them, it will be having a flu vaccine for the first time ever in their lives. But please go and get it.
Okay. Talking about that, let's talk about the campaign, Making Flu Prevention My New Normal. What is the campaign about?
Okay, so basically that's part of the messaging. So we know that we all have to have a new normal. So our new normal should include having that flu vaccine so that hopefully some of us might still have flu even if we've had the flu vaccine, but fewer. And when we get flu, it's less severe. And hopefully then that will actually be part of our strategy to reduce the impact of COVID-19 on our healthcare system as well as our economy. So it's very, very important that we all do the right things. And there is actually a website that you can go to. The website address is www.actoflove.ifl.my. So please go to that website, and what we would like people to do is to click on a button to support the campaign. What we want to do is to collect 300,000 pledges to actually help us to support our campaign, to help encourage more people to actually, well, we want the whole population, to be honest, to actually go and get a flu jab.
Okay. Let's move on. Final question for you. The future plans for the campaign, what is the campaign being done? What is going to be done in this month, next month for the campaign? And what the public can do, they can support the campaign, and things like, what other things that they can do as well?
Okay, so the public must, first of all, go to the website, click on the button, read what's on the website, and spread the news. Tell other people about our campaign so that they can also support our campaign. What this campaign is about is to increase awareness, we will be holding a concert with our local celebrities. Now, details I can't reveal. It's a surprise for everyone.
They can go to the website and check it out, right?
Yes, okay. That's right. Yes, and then what we will actually continue to do is to actually lobby. Yeah, so we lobby with the policymakers, and we lobby with kind of healthcare providers, organizations, to actually push for everyone to introduce flu vaccines.
Okay, all right. I think we have some visuals from the campaign, and enjoy the visuals from the campaign.
Berjangkit sepanjang tahun, Pertubuhan Kesihatan Sedunia telah menasihati orang ramai untuk mencegah influenza, walaupun semasa pandemik COVID-19.
Influenza adalah penyakit berjangkit pada saluran pernafasan. Kanak-kanak berisiko tinggi mendapat komplikasi dan maut akibat influenza. Lindungi mereka dengan mendapatkan vaksinasi tahunan influenza.
So, Prof, thank you so much for joining me today. I enjoyed the conversation, and I hope that making flu prevention my new normal becomes our new normal as well.
Yeah, and good luck as well for the rest of the year.
Thank you so much, and thank you. For
Don't forget your flu jab this year.
Okay, don't forget my flu jab. Okay, all right. I'll get my flu jab as soon as I can.
Good.
All right. Thank you so much for watching. This has been Health Matters with me, Dishen Kumar. I'll see you in the next episode. Goodbye.